everyone. Welcome to the podcast. Hi, Lisa. How are you?
I'm good, Katie. How are you?
We are in our comfortable. Each episode, the level of comfort just keeps increasing. So tune in next time. We are going to be Katie and Lisa after hours with a glass of wine.
That part.
That is the goal here. But yeah, I'm excited for our guest today.
Me
You
too.
know her. I've been able to speak with her once in a different call, and I'm really excited to just connect and hear more about her. So,
Yes.
welcome to the podcast, Dr. Morgan Francis. We're so happy to have you.
Thank you so much for having me. I'm really looking forward to our conversation.
Yes. Well, before we get started, just let our listeners know who are you and what do you do?
Yes, so I am a licensed therapist in a degree with clinical psychology in Scottsdale, Arizona, and I own a private practice where I specialize in the treatment of body image, eating disorders, and sexual health. I've been practicing for, oh my goodness, at least maybe 15, close to 20 years. So prior
Wow.
to opening up my own practice, I worked at a group practice where I specialized in working with men who were struggling with sexual compulsivity, and a big focus of my treatment there was body image work with them, which was quite fascinating. And then once I had 3 children in 3 years, I needed to be able to have my own schedule and flexibility.
Whew.
So I then opened up my own practice, and it's been going great ever since. So I feel truly blessed to be able to work with the people that I get to see.
Wow. I have
Wow.
I have so many follow-up questions on that, but that's I don't think that's the purpose of our conversation today. But that's really a wide scope of, opportunities and experience in helping people recover from, body image and all the things. So thanks for sharing that.
Yeah. Well,
Absolutely.
yeah, let's dive in. Let's start with sort of the big question around here, which is, what is a belief that you once had about yourself that you no longer have that has shifted your life in a meaningful way?
That I needed to be skinny in order to be loved. And I don't mean just
Mm.
loved by others, but love myself, right? Truly be,
Mm.
uh, I would say, alive and happy and thriving in my body. When I was a teenager, my eating disorder emerged, and I remember very clearly the thoughts every day were, what am I going to eat and what am I going to do to get rid of it? And that consumed me, and it didn't matter what I was doing. I could be playing my favorite sport, I could be having sex, and I would literally be thinking about, what am I going to eat and how am I going to get rid of it? So, through my own personal work of therapy and lots of reading and consuming psychoeducation and understanding body image, did I fully become very safe. I felt safe. I feel safe in my body, and it's a great feeling. And so that's really something I want to help others to find. That obviously we all know the diet culture myths that make us believe that we have to look a certain way and be a certain size. And so that's why I feel so passionate about the work that I do, because I've been on the couch. So that's why I do what I do.
So speak more to that safety piece because I think the thing that's tricky, and this is a big component of diet culture, is that we often don't know we're in it. And so, like, we could be thinking, I do feel safe in my body. And, like, yeah, I might always be thinking about the next thing I'm eating, or I might always be,
But that's healthy.
yeah. So it's like, yeah, I'm really health conscious, right?
Right.
So, how do we even gain awareness of this particular physical safety as it pertains to my emotional and even physical well-being is like how do we even gain awareness into if like that belief or how do we know we're in it or like how do we it just seems so nuanced and layered to me.
Yeah.
So that's a great question. And so in my field in psychology, we look to see how intrusive those thoughts are, right? So
Okay.
it's more than just thinking about, okay, what's going to sound good and what's for dinner. It becomes something that is obsessive, where those thoughts intrude my ability to be in a relationship, to have friendships, where I couldn't think beyond that. I couldn't focus. And so we look to see what areas in your life that those thoughts are intruding. And if there is evidence of that, that's when we know that there's a problem.
Because I
Makes
think
sense.
like for I know like just because I know you and I for myself I think I could say that like you and I were very highly functioning.
Right, yeah.
But there was a lot of disordered behaviors around food and our body. And so I'm even trying to think about how I kind of shifted from that, but I would never have said that my thoughts are intrusive.
Right.
I can look back now and say, holy shit, that was intrusive and
Yeah.
obsessive. But because it was in the name of health, quote
Yeah.
those, I'm using a lot of big air quotes over here, because it was in the name of that, I would never have categorized those as obsessive and intrusive.
No, because that behavior is applauded.
Yes.
It's and it's normalized to an extent that like, oh, you're really healthy. I mean, I used to get so many compliments on how disciplined I was. Like, wow, you're so disciplined. Look at you doing all these things with 3 kids, and that is just amazing. So it made me feel really good and validated. I think for me, a part of the transition was recognizing that external validation wasn't as meaningful as I thought it would be, because when my body changed, when I didn't diet as much, or when I tried to scale back on my diet and my body changed, I didn't get those compliments anymore. And I realized relying on these is really not sustainable nor healthy. And then I expanded my definition of what health looked like. I think we all start with a very narrow understanding of health because of diet culture and the fitness industry, and this idea that health is about what you eat and how you move, how often you move, what movements you're choosing, and how little you can eat or what superfood is out that you can consume more of, like all of that. And we don't think about the other components of our health that are just as, if not more than, more important than what we eat and how we move.
Or it's like I think about thinking about my thoughts
Right.
and thinking about how they impact my life and thinking about my behaviors, not from the perspective of the validation I get, but from the perspective of, because I would have been able to say, I feel drained by this.
Right.
I just have to keep going. Like there is, I see this energy practitioner and this thing that she has in her office that says like myth, like healing is hard work. And like all this idea around hard work is like validated. And so I was thinking, oh, well, it is hard work to be healthy. And so, yeah, I'm giving my energy to it, but it's in the name of health and it's in the name of hard work. But if somebody would have come to me and said, what do you spend a lot of your energy on? I would have been able to then say that, but I wouldn't have been able to classify it as quote unquote negative.
Right. Right.
Yeah, I think that that's where the problem is, though, right? That we think that this is the way it should be. That this is what how women should exist. That we should push through. This is the hard work towards achieving the results. That if you're not constantly thinking about food or watching what you're eating or doing the math in your head, that you're going to, for me it was, oh, I'm going to get fat, I'm going to gain weight, and I'm going to be unhappy. But I was unhappy. I was extremely
That part.
unhappy. I was extremely anxious. I was lonely. I was withdrawn from my friends. I missed out on so much fun. And it didn't matter how thin I got. What I told myself is that, oh, if I just lost more weight, then it'll, again, the magic wand, then everything will be greater. Then he'll stop cheating on me, or then I'll get my father's approval, or then I'll be accepted by this friend group, or whatever it was. I had, so many different ideas in my head, but I was never happy. And so for my journey, it was really important to start pulling out those thoughts and identifying how much time and energy and money I was spending on trying to
part,
shrink
yeah.
my body. And I don't think, I mean, in my experience, I don't think we talk enough about how much financial burden goes into looking a certain way, right?
No, we don't.
To shrinking our bodies, eating the quote unquote, healthier, organic food, shopping at certain grocery stores, um, hiring, maybe certain trainers, or using supplements, or, being at certain
Mm-hmm.
gyms, or for some people that I see, the amount of cosmetic surgery that they undergo in order to achieve the look. And there's a
Yeah.
financial investment. It's almost like I want to, that show Black Mirror. You go
Oh,
around and see the
yes.
number next to how much people are actually spending on their body, so we really know what's going on.
What's really
Because it
happening? Yeah.
was, I mean, there a lot of my finances were going into trying to keep my body at a certain size, and it wasn't sustainable. And so because it wasn't sustainable, that's where my anxiety became worse and my mental health became very compromised.
We talked about that, I think, last quarter with a client. The financial impact of all the things that we've been taught to believe are important as women. And really, what it boils down to is the patriarchy, diet culture, capitalism. But this idea that our goal and our life's work as women is to be desirable, to look a certain way, to keep ourselves looking a certain way. And I know, obviously, you've done body image work with men, so I know men have body image stuff, but not to the extent that women do. And the way it's just thrown upon us as children, as little girls, we're taught, to keep certain things a certain way, to not do certain things, to it's really hard because I'm trying to raise. I have two daughters and a son. I'm trying to raise three feminists, and it's a lot of work because the messaging that exists everywhere says that women are supposed to, should, and that guest we spoke to, she was talking about how having women who are emotionally insecure, physically insecure with their bodies, and financially,
Dependent.
dependent, and stuck in a way because whatever financial power they do hold, they take such a huge amount of it and put it toward making their bodies look a certain way, making their faces look a certain way, trying to defy the aging process, which is like not real. But if we, and then the energy, like we talked about, the thought, if we took all of that energy, all of that money, all of our leadership skills, all of our brilliance and intelligence, like what we could be impacting, how we could be impacting the world would be like so serious, like so great, so huge, because then we wouldn't be focused on the stuff that's really not that important. And I always preface this with I like to look good. I don't think there's anything wrong. We don't shame people for having cosmetic surgery or doing whatever it is you think is best for you and that helps you feel good. But I think to your point, when you realize how much time and energy and emotion you're putting behind this thing and how much value you're putting on it and how it just doesn't make sense with the rest of your life and your other responsibilities and priorities and passions and goals. So I guess that's the piece. That's where you can look at it and say, like, this is not working for me. This isn't helping me. This isn't helping the next generation of women. This isn't contributing to the world in any meaningful way. It's vanity or aesthetics or just doing what we were taught, and what we saw growing up.
Hmm. I completely agree with everything you said. And also, in some of the work that I've done with my clients, it also comes from trauma. So,
Mm,
specific experiences where they felt tremendous amount of shame with regards to their body. And
yeah,
so there's also that piece too. It may not be just as a result of the pressures from the patriarchy and diet culture. It also is trauma. And so that also needs to be explored when I'm working with
right.
certain patients.
Yeah. That's important. Can you talk more about that? Because I don't know if people recognize,
Well, I feel like
like,
it's kind of a buzzword, and I think
yeah,
that people think that in order to have trauma, there has to be something incredibly
right,
like like this incredibly huge thing that happened to you in order for it to exist. So yeah, bringing some light to what that word means and how
Yeah.
it can influence our relationship to self.
Well, I'm a big fan of Dr. Gabor Mate's work, and I really like how he
Yeah.
defines trauma. He talks about how trauma is not what happened to you. So it's not the divorce, it's not the affair, it's not the sexual abuse. It's what happened to inside of you as a result of what happened to you. So, for example, because let's say, because I was in a relationship where my partner had an affair and gaslit me, as a result, I have a really hard time trusting anyone. And I constantly am questioning myself and others because the last time I trusted someone, they violated and betrayed that trust and used it against me. So now I may seem very anxious or need constant reassurance from the people around me. So that's the trauma. It's not the fact that I experienced an affair. It's the fact that now my world has had to adjust. My nervous system has had to adjust. My sense of safety has had to adjust. And so we're constantly making adjustments. And so what I really try to share with my clients is that there's going to be little T's, meaning like little traumas. So maybe you fell out of a tree when you were climbing when you were a kid and you couldn't pitch in your baseball game. And that baseball game meant the world to you. And that's a trauma for a little kid, all the way to a
Right.
big T, right? Where, there could have been something where your parents got divorced or there was a death of a loved one. So traumas are a continuum, right? They're all different and they each have an impact on us. And so to me, I make sure that no experience is too little to talk about, right? It's important to share what we've gone through so that we can hold space for our experiences and get to really know the person in a very compassionate and safe way so that they feel like they can talk about all experiences, even the good ones. Because I don't know about you, but I know a lot of people that have a hard time even being with joy and happiness because maybe they had experienced it and got ripped away from them. So there's vulnerability and joy as much as, if not, also with the vulnerability and pain.
That's a good point. Yeah, I don't think I've thought about that recently, but as soon as you said it, like people in my life came to mind,
Mm-hmm.
like that I know struggle to just sit in joy and to sit
Mm-hmm.
in good feelings. Almost like they're scared or they expect that it's not going to last long or they're waiting
Mm-hmm.
for the other shoe to drop. And I have felt myself going down that path before where it's like don't get too excited. But I know someone in particular who has stated that they try to live their life in the gray, like not getting too excited, not getting too upset, but trying to stay as even keeled as possible. And this person thinks that that is a positive, like, personality trait because it just keeps you, centered or like that homeostasis. But I think that not experiencing joy and not being able to even sit in and experience your pain impacts your ability to experience joy and to even know what it is, right? Because we don't get the good stuff without the bad stuff, unfortunately. That's the way life, like there's no good without bad. So we have to be able to experience both. So that really that hit a nerve for me because I know people who don't know how to just process joy and take it and enjoy it. It's kind of like, okay, like trying to almost like
Mm-hmm.
hold back. I don't want to give too much energy to this thing, but it's like, why not?
Mm-hmm.
Like you're missing out on the best parts of life when we do get that joy, Take advantage of it.
Yeah, mine shows up like I could just be driving and just thinking about my kids and my husband and life's good, and all of a sudden, like I'll imagine them drowning. Like it's the
Oh,
most bizarre thing, and
yeah.
I'm like, what? Why did my brain go
Yeah.
there? Like, what was that about? Why did that need to
Mm.
happen? And it's interesting. I had a conversation with a woman, and she posted this picture. Like she's, I think, I don't know, somewhere abroad in Europe, and she was sitting on this beautiful balcony, and all of a sudden she's like, oh my gosh, you guys! Like all of a sudden I had this thought of I'm gonna fall off this balcony and die. Like what is wrong with me? And so I DM'd her and let her know, like, it just can come into that because you're calm, you're feeling safe, you're content, you're happy, you're at peace, and then all of a sudden it's like, wait, don't be there for too long. That can go away. So it happens.
I mean, yeah, I think that when you put it in that way, that like joy can feel like when you're saying like somebody has experienced any level of trauma in any area, being vulnerable about that is very difficult. And we think about that often from like the negative side of it, but maybe someone experienced a lot of joy, like you said, and had that ripped from them. And so that in itself is the trauma. So being vulnerable with the joy is is hard to do that. And I think it's our maybe our brain's way of just trying to keep us safe so that way we can protect ourselves in case that happens again. It just takes us back into the past in order to quote unquote, I'm like the queen of like, how do I prevent the next thing from happening? But it comes from like my best friend tragically dying when I was 16, and then my dear friend and cousin tragically suddenly also, it was like these sudden deaths, like dying when she was
Yes.
38. And so it's like, uh-oh, don't get too attached, you know, like if I don't hear from my best friend from a little while, I'll instantly be like, she died, something happened to her, you know. And it's like that's just the doesn't mean it's true. I mean, the feelings aren't facts, but it doesn't mean that it's not a real experience. And I can relate to that feeling of like, oh, don't get too excited because the pain will be too much to bear if you're too happy about it and it goes away.
Yes.
But does that
Yes.
even
Yes.
work?
And I can relate. I'm sorry. Go ahead.
No, I was just gonna say, does that even work? Like, is that even a like that thought process around it? Like, don't get too happy because then it'll be harder. Like, is that? I mean, you work with people all the
I didn't
time.
say it was logical, Lisa.
No,
I
I
didn't say
know.
it was logical. No, it doesn't work.
Yeah, but like, yeah, I just think for
I
our
can answer that for
listeners,
myself. It does not work.
it doesn't help. You're still sad. Like, yeah,
But the neural pathway is very deep.
right. I hear you.
I think in that case, it's more. I would go more talking about the grief and the loss, right, and the trauma around the grief and loss, and how that shaped you, right. I mean, I can relate. I lost my brother in a tragic car accident when I was 16, so that definitely shaped me. And so a lot of my response to my trauma comes from that origin, right? And so it makes, I mean, literally, it makes sense to me why I would then have this thought of my family drowning, right? Because of what I have, previously experienced. So sometimes it's just not trying to fix it, but also understanding and being compassionate to ourselves. Like you would to, I don't know, a really close friend or someone you love. Like, hey, that's okay. It's okay. I
Yeah.
know that that can be scary, that that joy comes up and you're so afraid that it's going to go away because that was a reality for you. So let's just sit in that and it'll come back. The joy will come back and you're safe. So instead of trying to
And
change
I
it,
think we try to math our way out of it. Like it's like this like well, the trauma lives in this category and I don't see how it bleeds into other categories, right? So we kind of I do that. I like compartmentalize and until I think we really can just get even maybe honest with ourselves. Like my friend dying in the car accident was not just that teenage version of myself. That that person that I am today is impacted by that in a very different way.
Right.
So it was my friend and her sister who died. And so when I've said this before, like when I had my second daughter, now that trauma gets to come out through hypervigilance of my two children because now I'm reliving that death through the eyes of the mother and not through the eyes of the 16-year-old girl.
Yeah.
And so it's like trauma's a bitch like that. It like it just it's sneaky.
Yeah.
It just doesn't always present itself in this mathematically clear equation. I feel like it can be really, really sneaky and it can go everywhere and it's hard to always trace why that's happening and where that's coming up.
yes, yes. And so I like what you just brought up because I think a lot of people, especially with the work that I do, they're like, well, I've already talked about that. why do I need to keep talking about it? I mean, I dealt with that in, my previous therapy when I was 12 or, in my 20s, and I have maybe a gentleman who's in his 50s sitting in front of me. And so what I have to try to explain is it's always a part of you. It's not something that just goes away just because you talked about it in your 20s. And like you said, like now it takes on a different manifestation compared to when you were younger. And so it's important to be able to look at it from different lenses of our life because we are constantly evolving. So the way that we respond to our trauma can also evolve.
Yeah. Wow.
I didn't know we were going to go down this trauma lane. That's how these conversations happen. I'm glad that we did though, and Katie, yeah, I really appreciate you bringing that up, like the shifting in how you're impacted by the trauma now, because I mean, what you just said, Dr. Morgan, like this idea of like I've already talked about this, I've already dealt with this, but it's just like grief, right? It comes back. Like I lost my dad when I was 16, and that's so long ago now, right? But there are still times that I can be moved, to tears or real grief around not having his presence, or something will make me think of him. So it doesn't just disappear. Like it comes back. Our traumas, our hurts, the pain, the grief, we experience it, throughout our life. And there's nothing wrong with it. I think sometimes, on our quest to be healed, we don't want to like have to rehash the stuff or dig up the stuff or think through the stuff, but I think it's very valuable and very important. So
But I think that's part of being our authentic selves.
yeah,
Is accepting that that is a part of us.
It
And not
is.
I'll be my authentic self once I've healed from it. It's like, nope, this is a part of who I am. And guess what? Like the closest people that I have in my life know those parts of me, and they don't want to wish those parts away. They actually care for those parts. Do you know what I mean? Like some of my dearest friends, like one of my friends really, and I feel like every person in our life can have a different meaning in a different way for a different part.
Yeah.
So I have a different really good friend who has a lot of the similar hypervigilance around parenthood. So I was telling her some of the hypervigilant routines that I have, and she was the sweet. She sent me a voicemail back crying, saying the thought of you getting up checking on your kids that many times is I can't even begin to, like, I just am watching this in my mind and just feeling for you, Katie. Like I can really hold significant space for you in this and understand, and I'm so sorry. And like love my partner dearly, but he's like, why do you keep getting up and checking on them? Like it's just because he doesn't relate to me in that way, and it's okay. Like I don't need him to relate to me in every category of my stuff, but it's that that's part of being the authentic self. Is not like, okay, well, I'm working on myself, I'm a work in progress, and that authentic self is coming out. No, you're authentic today, regardless of where you are, because that is who you are.
Yeah.
And no one escapes any of this trauma anyway, and no one's going to be fully quote unquote healed anyway.
No.
So it's like shifting even that belief and allowing ourselves permission to just be the messy self. I think the more all of us do that, the less pressure we all get to sit under, and the more authentic connection we actually get to have. I don't try to change myself for some of the closest people in my life at all.
Yeah.
Like they just are there for it. And I think that if we can start adapting what the value of that is in our society, in our culture, and create this more quote unquote normal narrative around what that means, I think that we'll all just have so much more empathy and compassion and acceptance and allowance and all of the beautiful things that human beings can coexist with.
I love that. I really love that permission because I think we need more of it to be our true selves, like you said, our authentic self, and feel safe in doing so.
And like the premise of this podcast, even asking you that question, like, what's a belief that has changed, that has, you've changed, that has impacted your life in a meaningful way, is not to say, okay, Dr. Francis, what have you healed from? Because I bet if I asked you if that belief doesn't try to creep in, you would be like, hell, like, I mean, I don't know, you could answer, but I'm like, it's like, the whole shift of the belief is not so that we are now perfect. The shift in the belief is like the more of the compassion and acceptance for self rather than it goes away.
Yeah, and sure, I'm happy to answer it. So that belief comes in a different way, and I think kind of goes back to what you said, like about grief and trauma. So for me, my body image work, as I age, getting more comfortable with, the changes in my body, the changes in my skin as I age, and embracing that because I didn't have people around me, women around me that embraced themselves as they aged. So it's very important to me to, and like go through the process and sit with it and just be an accepting place. The other piece is that I had skin cancer a couple years ago. And so I had a significant amount of surgery on a body part. And so it looks different. And so being okay with my appearance after the surgery. And so, being okay with still wearing clothing that I love to wear. And so what if this is being seen? And embracing that part of my body image. So it's shown up a little bit differently for me now. It's not for me about weight and shape. I work out for longevity and for my medical well-being. My workouts look very different than they did when I was in my 20s, and that's purposeful. And so it's evolved. And then especially being a mother, trying to really, help my 12-year-old navigate her own body image. But it's interesting because, and I've shared this before, I think I've done such good work that she's like, ready to take on the world and it's like all this stuff. But I
Same.
didn't really think to do the same amount of work with my boys. And my oldest boy, my middle child, he struggles. He struggles with feeling, confident and secure in his appearance. And so it's interesting because I thought, oh, I got to put all this work into my daughter, being a female. But it's also been eye-opening to see how some of the things my son has mentioned. So it's been a new area that I'm trying to support for him.
Oh, I like that you said that because again, raising a boy as well, that's not something he came out very confident, like very
Mm-hmm.
very much like I don't think my son wears a shirt in the house ever these days. He's just,
Yeah.
he might be a little too into himself. We might have to have a talk, but he's just confident and just happy with who he is, and I have to force him to still brush his teeth and brush his hair because he just doesn't care, and it just such a freedom. And as a parent, it's like you have to brush your teeth. Like hygiene is non-negotiable in our home. But it's
Right.
just seeing the differences between the boy and the girl. Like he just doesn't care. Meanwhile, my girls are, 11 and 13, trying to wear mascara and taking my eyebrow brush, just to brush their eyebrows and make them look perfectly. And I'm just cracking up because I'm like, they're so different. But boys, men have struggles with their body image as well. And I think it's important to highlight that. And because you've worked with even adults with body image issues and men, how has or maybe, I mean, I don't know, maybe it's tips you can share, but I'm really curious to know how helping people shift their beliefs around their bodies in the same way you shifted your belief around your body and what you deserved and how you could be happy and successful. How does that show up when you're either engaging with clients and or your children? And then especially as we talk about the differences between boys and girls or men and women, what does that look like for you? Or what, I don't know, wisdom can you share for those of us raising boys too? But
Yeah.
yeah, I would just love to hear more from you on that front.
So the when I worked with men, it was very specific to sexual health. So,
Okay.
it wasn't as much about, shape and size and weight, although those topics did come up.
Mm-hmm.
For them, it was, they lost their hair when they were, younger compared to their friends. And so there was insecurity around,
Mm.
going bald. there was insecurity about, their vision loss, so having to wear glasses, or their height differences and not feeling, they were the smaller friend. But a lot of it had to do with the size of their penis. I mean, I don't know how else to say it. I just have to say what it was. And so a lot of it talked, a lot of the conversation was about, their sexual health and or early sexual experiences that they either had with other males and or females. And the sexual compulsivity piece um, around their behavior. So the body image really focused on understanding like how they identified feeling masculine, and then also how they identified feeling feminine, and then seeing those parts and how those emerged. So that was really a lot of the work, and I worked a lot with pornography, and so that also came up a lot too. Um, I hope that answered your question. I don't
Wait,
know if I did.
I have to get a clarifying question here. So, because this is like a really not talked about topic.
Yeah.
So, what I hear you, and tell me if I'm understanding it correctly, is like, are you saying that you saw men have um, insecurities with their body, and then there were behaviors around sexual compulsion that were linked to their relationship to their body?
Yes.
Oh, interesting.
Very.
Yeah.
Interesting.
So
Okay.
I'll come up with an example.
That's a fascinating correlation. Yeah.
Yeah. So let's say, for example, one of the men I worked with felt very insecure about the size of his penis. And maybe there might have been, jokes or comments made from friends. Maybe not so much in a bullying way. I don't want to say that this person was bullied, but in a way that it made him feel insecure, right? So because there was this sense of security, pornography became something that was, easily accessible and was used as a way to not feel rejected. I mean, that's really the bottom line, because pornography is available and there is no consent and there's no rejection. I mean, you can look at anything you want to look at for however long and then move on to the next and all the things. So, for some men that have experienced rejection, or they feel that they would be rejected, pornography is a way for them to feel accepted and pleasured and all the things. And so, in my work where I worked, it wasn't that pornography was bad or wrong. It wasn't about shaming the person. It was, again, how has pornography become a problem in your life? And so the men that were coming to the practice I worked at, pornography was a problem, right? It was causing problems with their work, with their relationships. They had signs of erectile dysfunction at a very, younger age. And so there was a whole host of things that we would be discussing. So body image was definitely a piece around the work that I did with the men that I saw, because even if we look at early childhood trauma, the most two readily available resources for children is food and sex or masturbation. So food is right there in the house, in the cupboards or the refrigerator, and then there's masturbation. So typically those are the two most utilized resources for children when they're coping through early childhood trauma. And so for some of the men, it was pornography, and it also might have been food. And so understanding that connection was very important for them in their work.
I mean, I think for women, like when we're talking about our relationship to our body, it's like you can kind of put the dots together, like pretty, or like when you really are saying, this is showing up for me, I don't like it, let me try to connect the dots. Like with my hypervigilance with my children, I could connect those dots because the feeling felt familiar from when I experienced the trauma of her dying. But it's so fascinating to connect the dots, because I also think that it's not really normalized in our culture for men to be vulnerable, to talk about like these things, to show emotion, so all of those things create this container where maybe it would be significantly harder to connect the dots, because it's not as even socially acceptable to be speaking of or be vulnerable. Like it's not all the way socially acceptable. I mean, I accept it, but our culture doesn't accept men's vulnerability.
Right.
I would agree. Yeah, and it was very powerful work. So Where I formerly worked, it was a team, and so there would be 10 therapists that this patient would see on a daily basis, and so we each kind of had our specialty, and so then it really was an amazing program for them to come through, and it was very safe and confidential, obviously, but we had worked with a lot of high profile people, so they needed to have a safe place to go to be able to talk about these sensitive topics. But I really enjoyed the work that I did there. I was there for 10 years. And I'm very proud that I got to work with men in that capacity, because it is, like you said, it's very hard for them to feel vulnerable. And so, yeah, it was really important work.
Just connecting all those dots.
Yeah.
Man, human beings are so complicated.
Yes.
Wow.
Well, Dr. Francis, we really love talking with you and having such a wonderful conversation and just painting light on this very, I think, common feeling that a lot of people feel around their worth and their inability to show up as their authentic self because they feel that if I don't look a certain way, I won't be accepted. And how can you show up as your authentic self and your most authentic, powerful self with these beliefs? So again, the whole premise of this is just to continue to offer people a safe, place where we can connect with each other and be vulnerable and share our experiences so that we all don't have to feel alone in this wild human journey that we're all on. So
Wow.
thank you so much for your vulnerability and for your share and for your expertise and professional insights. It's been a pleasure connecting with you. So let our listeners know where they can find you and some more of the work that you do.
Yes. Well, thank you so much for having me on the show. I feel like we did such a great job of talking about such a variety of topics. So I feel like there's a little bit of something for each and every person of your listeners to take something from this episode. You all can find me on Instagram. That's basically the easiest place, and it's at Dr. Morgan Francis. I also have several online courses and free handouts that people can download and take a listen to any of the podcasts that I've been on to understand more around the work that I do. But thank you so much for having me on. It's been really an honor, and I'm so grateful for the conversation we were able to have today.
Absolutely.
Wonderful. Well, thank you again, and thank you to all of our listeners. We will see you next week.